right. I have the top of the hour here at 11 o'clock. I just wanted to say thank you to everyone who has been with us throughout the last three, and welcome to those who this might be your first in the series here. This is the last session in the four-part communication series in collaboration with Legato. Today we are talking about the Behavioral Health Toolkit. As always, we on the Delta program, we are funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. For those of you who don't know, my name is Caleb Blazinski, and I am the Telehealth and Outreach Coordinator here on the DRCHSD program. Please connect your video feature if you haven't done so. If you dialed in today's call, you can press *6 to unmute your line, and you can also communicate through the chat box. And I'll be monitoring that chat box. If you are not speaking, however, please do keep yourself on mute. It helps us cut down on feedback. As I mentioned at the start of this webinar today, this is the last in the series in the four-part educational series. And the center is committed to diversity, equity, inclusion, and anti-racism. For additional resources, please visit our website to assist in our organization's commitment. All right, I will turn things over to Amy as I start here the pre-polling questions. Feel free to fill those out at your leisure. Amy is the Vice President of Strategic Services of Legato Healthcare Marketing. Has over 10 years of experience in healthcare marketing. She's active in rural healthcare advocacy and was recognized for this work in 2015 as a Rural Health Ambassador by the Rural Wisconsin Health Cooperative. Amy, I will turn it over to you.
Hello, everybody. Thanks so much for joining me today. This one's going to be a little bit different look and feel than what we've traditionally done with you all, where more of the information is one way. We're looking for a two-way communication piece today with our behavioral health toolkit and getting some feedback from you all on some of the work that we've started and some of the deliverables that we have proposed, and then also a video component and getting some feedback from you all on logistically what that means for you in your communities. So the pre-polling, I think, is complete, or did we want to do those right now, Caleb, or?
Yep, sorry, I already pulled them up in there.
Okay. Good. All right. Awesome. So like I said, we'll be talking about the Behavioral Health Communications Toolkit itself and just the campaign messaging that we've developed, and show you the concepts that we have. We have six different concepts to share with you today, and all of the deliverables within that toolkit, and then just kind of getting some answers and questions on both sides today. So as we all know, we have a mental health crisis that has been going on for quite some time. And when I was doing my community health needs assessments for my organization, we had mental health as a top concern every single year, every 3 years. And the problem is not going away. And in rural, it has a tendency to just really stay inside the house and not get, we don't ask for help within our communities. And we really, when we started our conversation with the Resource Center, we really wanted to emphasize that we want people to be able to talk about this and hopefully decrease some of the stigma that exists. So just some statistics here for you all. I won't read them to you, but we know that it's a problem. And in rural, it might look a little bit different than urban, right? So we know that we can create this conversation. We know that there are tools that have been recently developed, like the 988 number. There are 211 resources available within some communities in our country. So our whole premise behind this toolkit is to try to direct people to those resources and begin to have that conversation. So when we started this work, y'all helped us out with a survey, just trying to get some of the feedback on where do we go from here? How do we develop what you need in your community? And you were really great in helping us let us know what resources were available in your communities that we might be able to refer to in our deliverables. What challenges specifically are you facing in your community when it comes to mental health? What are the most prevalent behavioral health issues in your community, and diversity of your community? Should we think about the Spanish population, African American populations? What populations specifically did you maybe want to see in some of the deliverables? And this participation in that survey really helped us to develop the concepts that you're going to see today. So each communication piece is going to have the option of 2 or call to actions. So we've got the phone number or the space for a website address that you'll be able to put into the concepts for your region or your area. And then also that 988 number. We're still in the infant stages of awareness throughout the country on what 988 is, what does it look like, that sort of thing. So we wanted to kind of keep that going with this campaign as well, to help raise awareness of that new 988 number that went in live this summer. So we're going to get into the concepts. I'm going to get out of my presentation so you can see these a little bit better, because I know it's kind of tiny on your screen. So let me get into those. I'll blow up certain portions of the message so you can see what we've got going on here. So the first one is depression. So the copy, I'll zoom in on that. Can you guys see that screen okay? All right. All right, so when it's not just the weather is our headline for this one. We've got stop the stigma and start the conversation as our subhead. Remember, we're reiterating that fact that we really want them to talk about it. Our copy says for the depression one, depression is a darkness that few can navigate alone. There's strength in understanding that you need help to find your way back to the light. Mental illnesses are common, real, and require treatment like any other health condition. If you are having thoughts of suicide or experiencing a mental health crisis, you are not alone. And then in all of the ads, you'll see the spot for you to be able to put your logo in for your organization, and then your call to action down here with the 988 line. And then over here will be the name of your organization or group and the phone number or website that they can go into that you can customize for your ads. Okay, so that's the depression one. Let's move on to the next one, which is for teen mental health. You can see in our image that our target is a young female. When it's more than just a phase, we often hear that about teenagers. Oh, it's just a phase. So we played off of that. And your copy says self-harm, anxiety, and depression among teens are diseases, not decisions. Knowing the signs is the first step toward getting help and healing. Mental illnesses are common, real, and need care like any other chronic condition. If your teen needs help, treatment can give them back their health and life. And then we have those same calls to action that we saw in the other ad. And if you have questions as we're going through these, don't be afraid to put those into the chat. I will try to keep an eye on that as I'm going through these as well, or just speak up. All right, let's talk about the next one, which is, excuse me, addiction. When it's more than just a night out. And we obviously will purchase these images once we have final approval from you all that these are the right images you'd like to see in your ads. And your copy on this one says, drug or alcohol dependence is a disease. Knowing you or someone you care for needs help is a sign of strength. Addiction doesn't discriminate. If you are struggling, you are not alone. There's support to help you take back your health and life. Again, same CTAs at the bottom. And the next one, when it's not in your head, on anxiety, is our focus on this one. If you are overwhelmed with thoughts you cannot control, you are not alone. There's strength in getting help to silence the storm. Anxiety disorders are common, real, and require treatment like any serious health condition. Asking for help is the first step to take back your health and life. All right, moving right along. PTSD, or post-traumatic stress disorder, when it's more than just a memory. Our focus obviously being our local veterans. in this particular ad. Trauma can leave behind wounds you cannot see, but the pain remains and grows, manifesting into anxiety, depression, and thoughts beyond your control, because the body remembers what the mind fights desperately to forget. Post-traumatic stress disorder is real, common, and may require treatment. Understand your past to find the future you deserve. Let's move on to your postpartum depression. When it's more than just the baby blues, we have that iStock image there. The copy in this one says extreme anxiety, hopelessness, invasive thoughts, and detachment from the baby you've always dreamed of are signs of postpartum depression. Postpartum depression is common, real, and requires medical treatment. There's no shame in taking care of yourself. Asking for help is the first step to take back your health and your life. All right. So there are your concepts that we have developed for you. I'll bring back up my PowerPoint. Are there any questions or feedback of things that you're seeing in any of the concepts?
This is Kelly. I would say a huge one is that it definitely works with, and I'm saying this as someone who has struggled with mental health issues. It actually does a really great job of working within the framework a person goes through when they're trying to decide, is this an actual problem? Is this something that's going to go away, or is this something that's here to stay? Do I need help? So it actually helps someone think through, is it just the baby blues? And it also, I think, works through those stigmas and the things that are often said to, for example, women, teenagers, and that I appreciate very, very much. So I really think these are great.
Thank you, Kelly. I appreciate that feedback.
Okay, can y'all hear me good?
Yes, Joyce.
Okay, my name is Joyce Carter, and I am a 20-some year patient of mental health. And right now, I'm not at my best day today because I'm going through a withdrawal because of medications. Our medications are not properly monitored, and we don't really get the best medication that we should get. I used to take name brand Ambien. I used to take name brand Wellbutrin, name brand Seroquel. All of that changed in the year 2009. So mixing up the medicine down through the years, and we need so much more. The medicine helps, the center works, but we need so much more. We need so much more. Every 3 months, you see your doctor that writes out your prescription, and you may get a council meeting while you're there in 3 months. Yeah, it's 3 months now. I gotta wait 3 months, nervous and shaking, trying to avoid going into the hospital because all that's, it's very disturbing. Like I said, I'm going through one of my withdrawals. It's like this SAD, the seasonal, and then I also suffer with bipolar. So we need so much more. I mean, nobody, you pick up the phone and call and check on the patients, however. And right now, what's really helping me get through the withdrawal is that I'm doing chiropractic treatments. And it really helps. I just went in today just to get, lined up. That helps until they can straighten out the right medication that I need, because they said I had been on the wrong medication for so long. Instead of taking depression medication, I should have been taking bipolar medication and, in the first place. So that's what I want to hit on. I want to hit on medication and how can we make sure that we're getting the best help, through our meds, and making sure that someone's on call to be there for us. Because like I have a son that's autistic and he's 25 years old. So I go through a lot. I developed this through having him. When I had him, I developed the postpartum, and then later on it got worse. So I started out like 1 pill a day, And then later on, those pills went to like 5. That 5 went to like 10. That 10 went to like 15. In 2018, I just got detoxed from medication that I shouldn't have been on. Like I say, the medicine is not really monitored properly, and it doesn't go with some of your physical medicine because I'm a heart attack and a stroke survivor. So some of my mental health medicine didn't go with my physical medicine. So some had to be pulled back for a while. So being off the Ambien for like about a week, and they had to restart me back on it. So it's like, wow, you know, it's a bad feeling. It's a terrible feeling when you're taking these meds and you're trying to regroup and make sure you get on the best meds and the right meds. It takes the body through a whole lot of changes. And I'm very thankful for you all coming on. I'm very thankful for this because this is a blessing. You know, whatever y'all can do to make it better for us, because there's so many can't speak for themselves. I'm just one of those that can, because I also am active in the program. And God has blessed me to have a ministry, mental health ministry of hope, which I do every first Sunday at the library here in Walls, Mississippi, to interact with those, to lead them to get the help they need, you know, whether it's a counselor, or psychiatrist, or whether they need to get some medicine. I was a former mental health counselor in Tunica County, working for Rosefort High School in the late 90s, where I worked with children that suffer with different, you know, depression disorders. And so that's how all this came about. I'm a former CDL driver for the Region 1 mental health program as well. So I'm trying to give back to my community to show them that, you know, we can get the help we need, but yeah, reaching out to others to be able, you know, to help others. I mean, it's a struggle. It's a struggle every day for me, especially when you're going through the withdrawals. And for some reason, around about the season times, I don't know what's this called, this holiday season come around, you know, loved ones have passed over year time, and you know, it's just struggling with it. It's not a good feeling, especially when the medicine is being detoxed and they're trying to get you on the right ones.
Thank you for sharing your story, Joyce.
I'm sorry it took me so long. I was trying to get it all done.
That's okay. So the call to action of, you know, asking for help or calling 988 or going to a resource page where you would maybe find medication management resources, or do you feel that we've hit the mark on the call to actions?
I mean, yes, very much.
Okay.
I have a comment. Can you guys hear me?
Yes.
When looking at the when you guys created this, what was the thought process behind the visuals? Because I'm a 30-year veteran of behavioral health, and one of the concerns that I've always had is most of the recipients of services are visual. So when they pick up a pamphlet or look at something, they're looking at it like, is that me? Does that look like me? So I see the photos, but as far as the diversity in each ad, how would I go if I was a Latino or a Spanish person and say, does this look like me? Not even reading, because the generation now don't read as much as we used to, So how is this going to draw in people besides reading that says that this is like me?
Mm-hmm. Yeah, we came up with a diverse group of photos for that. So are you requesting that there would be more diverse images to choose from for each concept?
That would be my suggestion, but it's just a suggestion, because if you put it in a group and they would have to flip through the whole booklet type of thing, then it will be okay. But if you just put out, if you were just focusing on depression or just focusing on anxiety, does this look like me without the words?
Yeah, how do the others feel about that, getting a couple more images within each of these?
Hi, this is Kimberly. Can you hear me?
Yes.
I think they're right on, they're spot on. I also, when you were reviewing them, some people experience multiple of these. They're very simultaneous. And I think they're very diverse, but so I think it's spot on. I think it's very well done because I think the majority has 2 or 3 or 4 of these, not just one. So I think it's very well done. I would use them just how they're presented here. So and I'm already thinking of how I'm going to highlight this, and because so many people have multiple of these, and so I think it's very well done.
Thank you.
I'm not negating the workout or how it's done. My question was just how, if you pulled one out, how would it look? Is that like me? Because of course we have multiple diagnoses, but not all diagnoses are the number one at the top. You have to address one and sometimes multiple at a time. But if I was focusing on my postpartum depression, you know, how does this look like me if I was just looking for the information? Like I say, most people are visual.
This is Tiffin. Can you hear me?
Yes.
And I agree with Ms. Corbin there. I think that looking at just the diversity within your own community, county, so forth, that if you're able to have a stock folder of pictures that you could, you know, pick from. I mean, every community is going to look a little bit different, or how is that going to be best presented within your community to get that biggest impact? I think that the verbiage and the overall layout to grab that attention is there. But I think I agree with, you know, I was looking through this and just thinking of our own community. There are some of these that I think, again, yeah, that some of this is not going to fly, and maybe our diversity is totally different than maybe Ms. Corbin's diversity. So I think that if you're able to maybe tweak it just a little bit of those pictures, it could have a greater impact. I hate to use the word marketing, but in a way you are marketing this to your community because you want them to see it, you want them to feel it, and to know that this is truly about them, and that there is, you know, I look at some of these and I think, well, you know, we're kind of a ranching community, so to speak. And I look at some of these pictures and that's not going to connect with some of them. But at the same time, you can't be everything for everyone. But if there was just a little bit of change that you could tweak just to meet your community needs, I think that would be helpful.
Hi, everybody. This is Mike. I work with Amy. I've been on a couple of these other ones. I just want to chime in to say that I think that could certainly be done in terms of, you know, providing a couple different options. Excuse me. And depending on, you know, how many of these ads you might run, you could certainly rotate as well to have, you know, of different demographics and such as well. So you represent that. The one caution, excuse me, that I would make though is we also, you know, there could be a connotation, and I know this wouldn't be intended, but just to be cognizant of this, that we're saying that only a certain demographic has behavioral health issues as well. You know what I mean? Right. So I understand the point
Very
of,
good point.
you know, so just something to kind of just be cognizant of it as all. So thank you.
There is a question out on the chat that says, can folks edit and use their own photos? Yes. Yep.
So I'm sorry. I mean, I think that would kind of resolve it, right? I mean, there's no way for you guys at Legato to have a person that looks like each kind of cultural diversity in a community, there's just an endless number of things that you would have to try to do, and it would be impossible. But if folks can use their own photos, you know, and edit, then they know their demographic, and they know exactly which part of that demographic struggles with, you know, for example, it's more than just baby blues. You know, if you have our facility is the only facility that does labor and delivery in our county. You know, that would be the one I wanted to use in my facility in that area of the hospital and in the clinics that provide those OB services. So I know who that demographic is, but there's no way for you to know that. So just saying, if you can edit your own photos, that solves the problem, because you could put in whatever you wanted to. So.
And I know you know, in some facilities, the staff will have access to software that can do that. We do customize things for clients as well, and we've done that before. So I'll get back with the resource center people, and we'll talk more about this and what that means for your group and all of that. Because for those of you that don't have that editing capability, do you still have a pool of ads that you can use if you don't have that capability? So I just want to make sure that we're meeting your needs, and maybe, you know, there's a couple of options that we can diversify this a little bit more, potentially, you know, but we will definitely take this back as a group and work on that. Sorry, I've got more chats coming in, so I just want to make sure that I'm hitting all of this. All right. So we obviously have created this pool of ads as they are. This will be the base of the kit. And for those of you that don't have those editing skills, this is what you're going to get. So if you feel like that is an impossibility for you, and that isn't going to meet your needs, you know, that's something we'll need to talk about with the resource center folks, because there are quite a few people that don't have access to do any customizing for their own organization. So just food for thought there. All right. So I want to move on to the deliverables within the toolkit and make sure that we're meeting your needs there as well. So within the toolkit deliverables, we obviously have the 6 print ad options that may change depending upon what we discover with the diversity issue. For those of you that don't have editing skills or editing capabilities, this is going to be the kit. So the 6 posters will be tied to this concept, same group of photos, same concepts, but a poster that can be printed in-house or with a professional printer. Educational flyers that meet the same concept. Social media posts and infographics that will align with these concepts. A radio script that you can record in your facilities or have your local radio station produce. A website landing page template that can be customized where you can fill in your local resources. And that we also have a partnership with Mental Health America. They have a great website where there are screening tools for many diagnoses. So if they are feeling depressed, they can take the depression screening. If they're feeling anxious, they can take the anxiety screening. There are several screening tools that we would link on that landing page as well. A handout card. One of the things that we worked on in my community with a group of stakeholders, to anyone who touched behavioral health, whether it be social workers, local police officers, guidance counselors in schools, the social workers within our own facility, mental health workers, community workers. There was a little card that we would hand out if there was a domestic issue, a police officer might have that they could hand to someone involved in that issue. The public health department also shared, everybody had access to these cards that we printed in mass that could be shared with, this is your resource, call 988, or the link to your community resource phone number. And then the general video and customizable story video. That's how we're going to wrap up today's conversation. Because one of the things that we wanted to video is, and especially the stories, I think Joyce was a perfect example of that today, sharing her story and hearing someone tell their story. Oh my gosh, that's me too. And that we were thinking that we would do originally just a general video that anyone could share on their social media, on their landing page, on their website, that could be shared nationwide. Then there was a question of, do we do a customizable video where we would have a bumper at the beginning of the video and a bumper at the end, and then in the middle would be a customizable video that you all would be able to throw in a local story. So we had a conversation about that recently with the Resource Center, because we know that this will make it even more authentic and memorable and more relatable from, say, a print ad. And hearing someone tell their story is so impactful, right? So the general video is about a minute long and something that you can use anywhere. The customizable video is something that was an idea that was proposed. And I guess our main feedback that we want to gather today is, how doable is that for you in your organization? Do you have the means to be able to gather a story locally and put that into this? Do you have video editing software that you would be able to do that editing? The Resource Center does have the capability of helping some organizations with that as well, and even getting local video. So some of the questions that we wanted to really get answers from you on today is, are you able to gather the stories? Do you have access to a videographer? If you don't, do you have good enough technology to try and gather those stories that you would be able to put in that customizable video? And then the last question we'll cover after we get done with the video question. So let's start with, do you all have a way to identify individuals that you'd be able to gather a very personal story on mental health? Is that something you see doable within your organization?
Okay, I'm gonna jump in on that right quick. I have a video already out there on YouTube with my pastor, Pastor Bartholomew Orr at Brown Missionary Baptist Church, when I come out, to really just tell about how it was making me feel. And so it's out there already. I have a story out there already. I'm just looking a little better than I am now, because I'm going through a withdrawal. But I do have a video. I have a story. It's like a 45, I think it was 45-minute long, but it was an interview and about depression and dealing with, coping with being a loss of my husband and dealing with my son, and everything. So
would you have a way to take that video story and edit that and put that in at your facility?
Yes, ma'am, I will be able to do that. Mm-hmm.
Okay. How about everybody else? What capabilities do you have in your organization to do something customized?
Hi, Amy. Can you hear me?
Yes, Shirley.
Shirley Brandon with Toolkit Resource Medical Clinic. We had Joyce, she's with us. She's one of our partners, and she's our team lead. So she's been, and our goal is mental health. So she's been very successful in our program. So Ambresia and I kind of talked already. So she would be one of those spokespersons for us. And we have a couple more that we can work on, but she would be that main person that can share her story to try to help someone else. So we're in the process of trying to get that done. So.
Okay.
Yeah, I'm at Franklin Medical in Winsboro, and we currently have a ad or video related specifically for behavioral health, because we have an IOP and a behavioral health clinic on campus. So we do have the technology to do all of these things.
Fabulous.
Amy, there's a few comments on the chat. I can just read for you here too. It's Kimberly says, I could get that myself. I just can't edit. Angela says, we are currently working on getting the capability to do things like this.
Mhm.
Someone else said we do not. So,
Okay. Okay. So there would still be the general video option that you all could use for your organizations. And then if you would want to customize it, you certainly could have that second option. But I'm getting for the most part that y'all do have access to some of this stuff to be able to do that local video yourselves within your organization. So that's super, super helpful for us. Ambrisha and I were looking for that feedback just to know where to go with that and what we should be producing for you all. So I super appreciate that. One of the things that she wanted us to, and this obviously you'll see this in the recording today, you'll have access to this PowerPoint, but for when you're gathering these stories, that customizable story, these were some prompts that we thought you could ask the people that you are interviewing when they're sharing their story, just to get those prompts going, record it, and ask these questions to get a really good story that you would be able to put into the customized video. So they also recommended that you just record the whole thing, let the person tell their story without stopping and starting the video, because you might get some really good stuff when you accidentally hit that stop record button. So that was one of the things that we wanted to make sure that we covered today. So going over the toolkit itself, we've got the video. I think we've got good direction there. I so appreciate that. We've got the other deliverables in this toolkit. Did we miss anything in the list that you would be looking for? Or is there something on this list that you're like, yeah, we probably wouldn't do that? I would just love some feedback on the list of deliverables. And if we nailed it, great. We will get to work on all of this stuff with the concepts too. So I'm assuming hearing nothing, it's all we're good to
I
go.
love it. I think it's great.
Okay.
I think it's the best.
Definitely.
It's
Definitely.
awesome.
And just to
I'm really
reiterate,
excited
I can do everything. I can get the content. I can do the interview. I can find the people. We have such a great community that is so willing to, they're just waiting to help. But when I have all that together, I need help. I need help putting it together. I don't have the editing or videography capability just yet, but to get it, to get a jump start, I would need help at that point.
All right. Any other feedback from the group? I see. Thank you, Chase. It looks pretty comprehensive and inclusive. TR Dudley, good work. Anxious to get access to the toolkit. Absolutely.
I have a question with the handout card. It's going to be specifically for our agency, because I'm thinking about the collaboration with other community partners that already have these cards out and they're giving them out, like the police department, like the sheriff and your city police departments that are already using these tools.
Mm-hmm. Yes, it would be customizable to your organization. Mm-hmm. Anything else from the group? I see a couple more chats came in. Do we have a timeline on when we will get the toolkit? We will take the feedback that we got today. The video will probably be the thing that takes us the longest to create. We'll be working on this over the next month or so with the holidays coming up. We've got a couple of days that we obviously won't be able to working on it, but our goal was, I think Ambrisha and I talked about, like, we would have everything in place hopefully by the end of the year. Outside of the video, that's going to take a little bit longer. That will go into 2023, but the rest of the deliverables will be done by the end of the year. You will have those in your hot little hands in December for sure. Let's see, this looks good. All right. Any other feedback or questions that you have on anything that we went over today?
I just want to tell you all, this is fabulous. This is like a prayer being answered for me and so many other patients that I know out there that's not able to sit here at the table and do this because they're on their bed of affliction. Mental health turned into physical illness for them, and then physical illness also can turn into mental health, and some people are dealing with them both, as of myself. And you know, being able to tell my story, I was able to make cards about my ministry, and if you go on the website, it's going to be Mental Health Ministry of Hope, Ministry of Hope. You can pull me up there. You can kind of like watch some of the stories, but I also got other patients that I have got acquainted with, because when I go to the center to get my medicines and get counseling, we all fellowship there. So I'm excited about getting with the men and women that's suffering just as much as I am, and some of them not able to come out the house at all, to be able to participate, you know, to get the help they need, and going to them where we'll be able to really put something together with what you all are doing. You know, I mean, I'm just excited about it, reaching out to the community there in Tunica to make that program better, because like I said, the program works, the medicine helps, but we need so much more because we are isolated. So much we can do, and so much we can say, and this is just on point. I mean, this is amazing.
Thank you.
Amazing.
Thanks, Joyce. I appreciate that. I will definitely make sure the design team and our creative squad knows and gets that feedback. So, Caleb, I think we have the one last polling to do.
Yep, we have a post polling, which we'll go ahead and launch here. Same questions as before with one tacked on at the end, just helps us measure knowledge gained here. I also did want to reiterate too, if you have any questions after this, any comments, feedback, suggestions, anything at all, reach out to any of us, reach out to Amy, reach out to me. We'd love to have the conversation, and I just really appreciate all of the feedback and the communication we're getting on this webinar today from everybody. It's all super appreciated.
I have a question. You know, I know that it's going to be challenging and uphill to break that stigma of mental illness and the negative connotation and the negative spin it has on it. And so many doctors give the example of it's just like diabetes, or it's just like I don't know, hypertension or something. Could you guys provide some content that speaks to that it's a real thing? It not say this, but it's just like diabetes, or it's just like another very diagnosed legit illness. It's a legitimate thing. I want to try to break that. I mean, we all do want to try to break that stigma of, you know, you're just crazy. You know, if there could be some content that says, you know, this is the results of what you get when you have diabetes. This is the results when you get, you know, Parkinson's. This is you know, something that's relatable to kind of break up that stigma.
How we currently have it phrased in some of the copy is like, for the anxiety one, for example, it says anxiety disorders are common, real, and require treatment like any serious health condition. So are you thinking that you would want it to maybe call out some of those serious conditions?
I think if that is keeping it above board, not offensive, you know, ethical, but I think so, just like diabetes, just like, you know, and name some of these that it's just like that. It's, you know, and someone said at the beginning, mental health stays inside the house in rural communities. That's exactly, that's why. It's, you know, it's because, you know, they probably, it's probably a couple of different reasons, but one of them is the stigma, you know, that it stays inside the house. So I don't know, could diabetes be named and Parkinson's be named? And I mean, could we name that on some of those? I'm just saying, you know, you don't have to answer, but just to kind of dilute the stigma and the belief. And
I hear you. I hear you. Yep. All right. Any other questions? All right. I think that's.
This is Mike. I'd like to just make a quick comment if I could. We definitely appreciate the accolades that you've mentioned, but I just want to know that the credit really goes to the National Rural Health Resource Center. We're simply a conduit of, you know, their vision and their strategy and their direction, their relationship with you. But we're happy to be part of that, and certainly happy to hear that we're moving in the right direction. So we look forward to the next steps. Thank you.
Thank you, Mike. All right, Caleb, I think that's a wrap.
Yeah, we got some great participation today, great participation in the polling, fantastic feedback. And again, just to reiterate, if you have any comments, questions, or concerns after this, just reach out. We'd love to have that conversation. Also, if you want to go over any of this again, all of the recordings will be posted to our website as well, as an email notification sent out with a quick SurveyMonkey and a link to all of the pages where these recordings will be held. So if there are no other questions, comments, or feedback at this time, it looks like y'all get 13 minutes back into your day.
Okay, I just want to say thanks, everybody, and happy Thanksgiving to all of you.
You as
Oh,
well.
you too, Joyce. Thank
Okay,
you.
have a good one. Okay, thank you.
Bye.
Have a great one.